version. We are learning from the previous versions, particularly around that integration of quality and performance monitoring, and our learning from the implementation of the first integrated framework that, as I say, was approved last year. As also mentioned in the committee reports earlier, we have tested our internal escalation mechanisms as described in the framework, and we haven't amended the detail of those in this version because of that testing and that evidence of improvement both in mental health and neurodevelopmental services for children and young people. One of the other important roles of the board, as mentioned by the chair, is setting the culture, tone and behaviours of the organisation. And there's an important ethos threaded through this framework, which is that quality and performance is everybody's business in the organisation. And it lays out that ward to board mechanisms from every individual in the organisation through to the board having those responsibilities. We have particularly strengthened the ongoing integration with the quality management system and quality reports. And I'll bring Claire in at the end of my introduction to talk about that. But we've also particularly strengthened the oversight and assurance of our commissioning and mechanisms and our commissioned services so that we can have good oversight and assurance of the quality and performance of those services. Again, as we've mentioned previously in this board, that being a large part of our work in Powys Teaching Health Board as a unique health board in NHS Wales. The cover paper makes reference to a strategic commissioning framework, which we are also developing, which will lay out our commissioning approach, building on the strategic commissioning framework that was in place for the health board prior to COVID, and making sure that that is up to date. We're bringing that forward to execs in June and through to the board later in the summer. The detailed changes in this version of the IQPF are detailed on pages 3 to 5. I'm not going to list those, take the paper as read. And it's here today for approval by the board for implementation immediately. And I'll bring in Claire just to talk about the quality aspects, Chair.
Diolch, thanks, Nick. So, Chair, I'd really like to state that I think the amendments and maturity of this report are really reflecting our strengthened position as an organisation to be able to discharge our duty of quality. I think in the updated version that we have in front of the board today, we can far more clearly demonstrate how we fulfil our duty to have a quality management system of quality planning, quality assurance, quality improvement and quality control. And in particular, our quality control element has really been demonstrated through our local escalation arrangements of service areas. Our guiding principles, I think, absolutely convey that we are an organisation that is quality led in terms of a culture of improvement and innovation and in promoting excellence and quality. But I'm also really pleased to see that we actually have really focused on transparency and accountability. And for me, that is incredibly important in terms of us as an organisation ensuring that we set the foundations for a culture of psychological safety, because without a culture of psychological safety, accountability and transparency cannot be embraced and improvement cannot be realised in a culture of learning, and rather without it we have a culture of blame. So I'm really pleased to see the amendments that are in there. I think it absolutely does strengthen us being a quality-led organisation, and the difference between this iteration and the last iteration clearly articulates, I think, our strength and maturity with a duty of quality. Thank you, Chair.
Thank you. Anything else from you, Nicola, or not?
No, thank you, Chair. Happy to open up for discussion.
Fine. Well, thank you so much for that. I think the journey we've made over the last couple of years is really significant. And, yes, it was on the back of some of it on the back of the duty of quality coming in, but that integration of quality and performance, both in terms of delivery and reporting, I think comes across very clearly and very loudly. And the changes and the amendments in the framework that are proposed to us today take that steps further. So much appreciated. Colleagues, would anyone like to come in with a comment or question? So yeah, Mick and then Kate, please. Sorry, sorry, it's Steve, Mick and Kate.
Thanks. A great piece of work. I just really wanted to welcome the establishment of the commissioning oversight and assurance group and the extra work that's been done around commissioning, given it it does cover 40% of our spend. So I think that's really important. So that's all I want to say. Thank you.
Thanks very much, Steve. And Mick.
Yeah, thanks, Carl. I mean, I would just echo what Steve said. It's a really impressive piece of work. It's great to see it all drawn together and, the different strands drawn together. It's really helpful. I mean, one of the things, as I read through it, the key takeaway for me was just what everybody's been saying all morning, is that kind of quality and safety being a golden thread that runs right through everything we do. And it's a golden thread that runs right through this document. But as I read it, I just wondered whether there was a disconnect between that principle and then what we actually monitor in terms of metrics and performance measures. So if you kind of, looking forward in the agenda, if you look at the IQPF reports later in the agenda, there are some qualitative measures there, and there are some others which, could be considered to be determinants of a high quality experience. But, just as I read it, the framework seems to me to be dominated by quantitative measures of treatment times, activity levels, waiting times. And I didn't see a great deal of direct focus on safety, and the measures around quality were few and far between. And I know that, having observed PECs, that there is an increasing level of understanding of what drives quality, and there's some kind of emerging data sets and metrics. So that was my kind of nagging doubt. I appreciate that what we focus on is driven to a large extent by what's dictated from the centre and what we're asked to report against. But it feels like there's a kind of disconnect between what we say we really value and what we focus on when we look at our performance. And I just wondered if that was a fair observation, and if so, what is the kind of long-term ambition in terms of where the framework goes next, and whether within a subsequent iteration of the document we could perhaps say something about its direction of travel.
Thank you, Mick. I can see that Kate and Claire would like to respond. Shall I invite them first, Nick, or would you want to come back initially?
Joe, if I can just come in briefly, I think Mick's point is very well made. I think it is worth noting that the majority of the IQPR as it stands is based on the national measures, and those are dictated by Welsh Government, and there is a balanced scorecard approach which Welsh Government uses around that. I think it is a large part of Claire's thinking and direction, and I know she's doing a lot of work on that right now in terms of our local measures and local reporting. And on that note, I'll bring Claire in to talk about that more now. Thank you, Chair.
Yeah, thanks, Nick. So, Mick, I think that's a really fair challenge, and I think it is a really fair observation. We're not probably alone as an organisation in terms of the ability to measure qualitative data as opposed to quantitative data. But I think where we will start to see this ongoing developing maturity, yes, I'm commenting positively on the maturity between our previous framework and this one, but that doesn't mean that we haven't got a long way to go in terms of the maturity that will continue with the framework. In terms of the integrated quality report, which is the quarterly report that goes through to the PECs committee, what I've tried to draw out in the IQPF is that is the way in which, or the vehicle in which in which we deliver the quadrant of quality in the IQPF. And certainly that needs to mature in terms of patient-reported experience, patient-reported outcomes, linking back to the People's Experience Framework, what we need to do with that, how we can draw out much better our themes and our concerns from instance and from complaints, etc. And also how we're starting to actually get quality data through some of the apps that we're developing as well, in terms of being able to translate local audits into actual quality data that we can track for improvement. So I think it's a really fair challenge, and one that I think we need to keep challenging ourselves on. But that is in our consciousness in terms of how that quality management system needs to develop and mature.
Kate, would you like to add to that, please?
Thank you. Really important question and quite topical. So absolutely. So the strengthening of the commissioning sort of review and quality scrutiny is really, really welcome and important. I am ambitious to have more clinical time committed to that. I'm noting our limited capacity, but I think it's really, really important, and that's certainly an ambition. In terms of the monitoring and the data, then most of the things we currently measure tend to be measured in time. We know that that's not necessarily always the most important measure, but it's probably the data that we've got. Much more important is looking at outcomes. And that's what we need to be moving into. We are actively looking at that. I think to date, there has been limited outcome information on many areas, but it is improving. So we've got the AMDs actually currently looking at what outcome data we have for key conditions such as cancer. And I think we absolutely need to be factoring that into our commissioning discussions and our decision making around choices of care and planning. So I think that will come. It's growing. The data is limited but growing, but still really, really important. And I think that we will always need to monitor against times, but in many situations, I think outcomes are probably more important, and that's where we'd all ultimately like to get to.
Thank you all. Mick, would you like to comment further?
No, thanks, Carl. I mean, that's reassuring. I understand this is really difficult, and I understand that, you know, we have to focus on the things that we're held to account for centrally, but it's reassuring to hear that we're thinking about broadening that out to focus on what really matters.
Okay, thank you all. So just before we leave Mick's point, Nicola, so how would we as a board keep in the loop, as it were, as to how, in relation to that, you know, yes, we've made significant steps. We've got the golden thread, as people have said, but, you know, how do we keep in the loop as to how that will further develop so that that disconnect, if you like, that Mick has identified becomes more connected?
Thank you. Yes, I was just writing a note to my team to ask them to have a think about how we link the integrated quality report, which goes to PECS, with the full IQPR. I think that would be a first step, because we do produce that report and there is a lot of information in there, actually both quantitative and qualitative, about quality and safety. And maybe we need to make sure we're aligning all that and it's equally visible. So I think that's the first step. And then I think we can lay out that programme of work to develop further local measures. On the outcomes piece, I talked about a strategic commissioning framework. Obviously, outcomes-based commissioning is one of our is part of our ethos, and we'll be bringing that forward, as I say, later in the summer, so that we'll tie our outcomes piece into our commissioning approach and our commissioning ethos, Chair. So we'll see more on that later in the summer as well.
Okay, I'm still not absolutely. Helen, you might want to come in. So where will we as a board remain cited on this?
So, Carl, it will initially come through reports from our Delivery and Performance and Patient Experience and Quality and Safety Committee, but perhaps Nick and I can take an action to have a look at it. My my professional view is that this is one that the whole board will want to receive an update on the progress of the work at the relevant point. So there's something about committee remits, there's something about that umbrella responsibility for the board, and I think that's a whole board issue.
Thank you. That's helpful, and thank you so much, Nicola. And I think the discussion that it's generated, I think in and of itself is testimony to the importance that we place on this and the quality of the information that you brought to us. So thank you. In relation to that, we are asked to approve the updated IQPF for implementation within the Health Board. I'll again pause just in case anyone wants to indicate that they don't support the recommendation. That is supported. Thank you very much. We then jump forward to item 3.5 and the health and safety report. And I'll invite Deb, please, to introduce this. And I understand that Mark is going to contribute as well.
Sure, thanks, Chair. Yes, so really pleased to be able to bring this annual health and safety report through. As you say, Mark, who's the Deputy Director for People and Culture, has joined me today. We earlier in the agenda that this report was also received and scrutinised by Delivery and Performance Committee recently. And the report sets out the delivery over the past financial year, and particularly the areas for improvement. It's a very broad report in that we cover a range of activities. So I'll just ask Mark to give some headlines if you would. Thanks.
Yeah, thank you, Deb. So yeah, the report, as Deb has said, seeks to provide assurance to board on our key areas of risk in terms of health and safety, but also how we are performing in those areas and how we use the data analysis and investigation then to drive our approach to mitigating the risks. So as Deb alluded to, it's quite a detailed report, so I won't go into all of the detail, just to draw out some of the headlines, if I may, and obviously I'm happy to take any questions. I think the first one to start with is the outcome from the audit report. So there is one outstanding recommendation that's linked to the corporate policy, health and safety policy. Just to provide assurance, the existing one remains extant. It's just that what we are trying to do at the moment is get a clearer picture on what we want to do in terms of tightening our governance arrangements for health and safety that need to be fed into a revised policy. And there's some further work being undertaken around the training requirements, but we want to make sure they are proportionate, pragmatic, and linked to our risks. So there's a bit of work still to be done, but we're hoping to get that over the line by the end of this first quarter. The other bits just to focus on, obviously we've had no health and safety interventions, health and safety executive interventions, which is again a real positive. And whilst there are some increases in our numbers of RID or reportable cases, as the report will provide, there aren't any kind of patterns or any concerns that we've got from the investigations that have been undertaken into those, and our numbers remain still relatively low and in line with some previous years. And our general health and safety accidents has seen a slight increase, only by 10 overall, but again, reassured by what we are seeing by way of the patterns of those incidents and the investigations that follow from them. The data in relation to PMVA, so that's your violence and aggression, there is a positive in that we've seen quite a significant reduction in the number of incidents that involve physical contact, so physical assault. So that's always welcome, but obviously we are not complacent. We see that there has been an increase overall in the number of incidents, in particular in relation to behaviour and abusive language. So something we're going to focus on in the coming year about how and what we do to support our workforce to make sure that they're not subject to those types of incidents. And then just finally, in relation to the training, so our overall compliance remains pretty strong. There were some concerns about Module D for the PMVA. Some of this, we believe, having done some more work, maybe linking to the reporting. So a number of people who've completed the PMVA Module D hadn't been updated onto ESR. So we're going to do a bit more work around that. But also what we will do is focus on making sure that compliance levels come up to where we are with the other areas of our health and safety training. And that's pretty much it for me, Chair, unless there's any specific questions.
Thank you both. And just a reminder to the board that this was scrutinised in some detail by the committee, by the Delivery and Performance Committee. So we don't need to repeat that here. We have received assurance from that committee via its report that that it is assured and that there are no items to bring to our attention for escalation and so on. So it's important just to make that connection. Ian, please come in.
Yeah, thanks, Chair. Thanks very much for this report. And that was a nice piece of coverage, I think, there, Mark. I think you highlighted, particularly towards the end there, the area that I just wanted to seek further assurance. Bearing in mind what the Chair's just said, this has gone through process and it's a good report, and I think it does demonstrate a high level of kind of corporate grip. So I'm very, very assured by that. In terms of the training and compliance, I just wondered, in a more general way, what we do in terms of communications to staff to ensure that they know that there's always compliance, there's always training that needs to be done in this particular area, and and how we actively encourage people to take the time to complete what they need to complete, because I think that does also then give a level of assurance to the public across Powys. So that's just my very, very general question. Thank you.
So if I could come back in, excuse me. So there's a combination of things here. And so the first one is, as you can see from the data we hold in the report, it's very much a grip around making sure compliance is up to date. So we constantly review that. That's done on a monthly basis, and there are regular conversations then with services and indeed with frontline managers about those individuals who may need to renew their compliance. There are also a series of what they call toolbox talks that happen. So that's a disaggregation of the information that we want to get to our frontline staff to make sure that they have a greater understanding. And the work that I referred to earlier around our policy, our corporate policy, what we're looking at is what's a proportionate and pragmatic approach to who we need to do more formalised training around health and safety that actually is aligned to our risks, rather than saying everyone has to be kind of sheep dipped through a process, and therefore we'd never probably get up to a reasonable level of compliance or indeed target our risks.
Thank you. So I invite Chris to come in, and then Deb and or Mark, you may want to offer any final comments, and then we'll move to the recommendation. Please, Chris.
Yes, thank you, Chair, and thank you, Mark and Deborah, for a very helpful report. Just one area to focus on, if I may. The violence and aggression, it indicates that there were 70 incidences that were undertaken. Correct me if I'm wrong, Mark or Deb, were those incidences mainly within the inpatient clinical areas, or were any of them within the home environments, within the community itself? And if so, any of our staff that are affected, what support do we put in play following those incidents?
Do you want me to come back in on that?
Yeah,
yes.
Okay. Yeah, so I think one of the things we picked up in the report, Chris, was the issue we're having around people being more specific about how they identify on Datex where incidents occur. So where there was a belief before, we probably did much more of the analysis than we now do, that a lot of incidents happen just within our mental health services, but actually that's not the case. And there is growing evidence of issues happening in a broad range of service areas and indeed locations. So one of the conversations I've had with our PMVA advisor is, how do we do more targeted work outside of those traditional areas where we've been more focused around formal training? So one of the things that we have begun to do is de-escalation training. and that is applicable to a range of different environments. So what we are very aware of is the use of the analysis of the data that should drive where we should be targeting our approach. So in simple answers, yes, it's happening not just within our kind of physical environments, our hospital sites, but there's still a predominant amount happening in those locations. So, and I think there's a growing trend that we are unfortunately seeing, I think, in the NHS. It's led to the establishment of a workforce safety board within Welsh Government, looking at this as a whole and what more can be done to support and protect staff. So obviously we are plugged into that. Would obviously be looking to take our own local actions anyway, as we're trying to do by being proactive based on the data.
Okay.
So thank you. Deb, you might want to add a comment, please do. And I know that Hayley wants to come in before we close the item.
Yeah, fine, thank you. Just on Chris's point, thank you for kind of the question, Chris. One of the things that Mark and I are looking at is how we strengthen resource within the training for violence and aggression. So I think if you can leave that one with us, we're aware, that clearly we need to have a set of offers and support to staff, given the numbers that we've quoted, even if proportionately they're low for us. Just back to the question that Ian asked around training, and just to broaden it out a bit, nationally there is a piece of work looking at all statutory and mandatory training, because we're conscious that it's quite a cluttered landscape, so that we are able to cleanse that at a national kind of agreed basis, so that the training is done on the right activities. And as part of a previous pay deal, there was an element around continual professional development and having some protected time, and obviously we contribute to the national consideration on that. So I understand the point of the question. I hope that helps to give some context.
Thanks, Deb. And Hayley, I think you okay with that, or do you want to add anything? You're all right. So it's covered the point that you were going to make. Thank you. In which case, thank you, Deb and Mark. We move to the recommendation that, as a board, we approve the health and safety annual report. No one's indicated that they don't, so that once again is approved. Just by way of indication, we will break for lunch after item 3.7, and we will take items 4.1 onwards after lunch. But we turn now to item 3.6, the Welsh Language Annual Report, and we're back with Deb.
Thank you. And just to add that we've got Adam Pearce, who is our Welsh Language and EDI lead, on the call, should there be any questions that I need Adam's support with. So I'm delighted to be able to present the Welsh Language Standard Annual Report covering the previous financial year, and updates through the year, as we heard earlier, have been received at People and Culture Committee. I'll take the report as read, but just pick out a few elements. So the report provides examples and evidence on how we've met the standards, training we've provided to staff, the handling of Welsh Language Commissioner investigations, and a growing number of Welsh language competency skills in our staff. In the past year, we introduced a new vacancy assessment tool. We've rolled out Welsh language for managers training. We've had an increased translation activity, together with reduced expenditure in that area. And we've seen an increase in Welsh language awareness compliance through the ESR module. We've also had a record for ourselves for this year, with 38 individuals completing some form of Welsh language training. So that's really important. One of the areas that has come up through our conversations, Chair, and in People and Culture Committee, is around our active offer. Just to confirm that we have issued 77 kind of Welsh language lanyards. We have publicised that there is a logo that can be put on uniforms, and we've continued to promote the use of badges, as I see that I think you're wearing today. So we have increased our active offer, and through a period of kind of scheduling and testing, we'll continue to do that. I'm happy to pause there, conscious of time, and take any questions. Thank you.
Well, thank you, Deb. You've already answered the question that was in my mind about the active offer and the use of the logo. Because I'm really pleased to hear that. I don't see it being used extensively across the organisation, so it would be really helpful, because it is a really key element in the delivery of the active offer, and so I'm very encouraged to hear that work is being done. But colleagues, please come in. Are there any questions or comments that anyone has in response to the Welsh Language Annual Report? No? So we are asked to approve the Welsh Language Standards Annual Monitoring Report. Subject to approval, the report will be made available both in Welsh and in English to the public by publishing on the Health Board's website. So I can see that you want to come in, Chris. Okay, I'll just pause briefly. If you come in, if you could be as brief as you can, Chris.
Yeah, I will do. It was just one question. Obviously, we've recruited some international nurses, and I just wondered whether any of those have asked for Welsh language training at all, or has it been offered?
It will be an offer available to all members of staff. I don't know if Adam is able to answer the question about whether any have actually accessed it. Thanks, Adam.
So, thanks, Deb. I'm not aware that any specifically have. I mean, I receive the names of the people, but of course I don't necessarily recognise the name, so you know, I won't necessarily know if that was an international member of staff or not. I'm not personally aware of any of our internationally recruited staff who've taken up that offer, but that offer, as Deb says, is open to all of our staff, regardless of their role within the organisation.
Okay, thank you.
Thanks all. So no one is indicating that they don't support the recommendation, and therefore that too is supported. Which turns our attention to item 3.7, the minutes of our previous meeting. Initially, for accuracy, are there any corrections, amendments or changes that anyone would like to suggest? There aren't, so those are accepted as a correct record. We have already dealt with the action log earlier in the meeting, but are there any other matters arising that haven't been dealt with on that action log or on any other agenda item? No. So thank you for that. So we will now take our half-hour lunch break, and we will reconvene, therefore, at 1:35, please. Thank you. Bon appétit.
Carl, apologies to interrupt you. I think you're just on mute there.
Fundamental error. Sincere apologies. Hopefully people can hear me now. I was just welcoming everyone back after lunch and explaining that we are going to pick up our business at agenda item 4.1, the escalation and intervention status level 4. Our delivery and performance committee has already received a number of reports around relating to our status, but this is the report to us as a board on the latest position, and I'm going to invite our Chief Executive Hayley to speak to it. Thank you, Hayley.
Thank you. I know there's a set of slides that will be put on. Great. So this presentation is going to give you an overview of the arrangements and the status of our escalation, the process that we're following, and also an overview of the de-escalation criteria. And I think it's really important that this is received in the public board, but as the chair has just referenced, there are additional mechanisms by which we'll be monitoring and reporting through to committees and board on the progress with regard to the position. Next slide, please. Thank you. So just a reminder, there are 5 levels of escalation with regard to the NHS Wales arrangements from 1 to 5. And we have had our status increased to level 4 for finance, strategy and planning in November. And just a bit of context around that, across Wales, one organisation is in level 5, which we're aware of, Betsy, Cadwaladr Health Board. And then out of the other health boards, for the domain of finance, strategy and planning, all the health boards in Wales are then on level 4, apart from Cwm Taf University Health Board, who is at level 3. We also have a number of domains which is covered within the framework, and those domains include finance, strategy and planning, performance and outcomes is the second domain, the third is governance, the fourth is leadership, capability and culture, the fifth is quality of care, and then the sixth is the fragility of fragile services. And as a result of this, just for your awareness and reminder, the Health Board is in routine monitoring across all the other domains. And I just wanted people to be aware of that as we move into the next slide, please. So you can see the differences between being at level 4 to level 3 is that we have had to adjust as a health board our capacity to respond to the additional intensity and frequency of the monitoring arrangements being put in place. So our integrated quality and performance delivery meetings now are held monthly instead of quarterly. There is a monthly meeting between Nicola and the planning team with planning professionals in Welsh Government. There's also a formal monthly meeting between Pete and the team and Leeds with Welsh Government regarding finance. And in fact, there is some weekly touch points with regard to finance on top of that. And then finally, we are moving to quarterly level 4 escalation meetings, which will be chaired by Judith Paget as Welsh Government Director General and NHS Wales Chief Executive. So it's been really important for us to adjust and to make sure that we are participating in those arrangements as defined by Welsh Government. On the next slide, this sets out the different roles and responsibilities, and I think it's really important that the difference between level 3 and level 4 escalation is that at level 4, this shifts for Welsh Government beyond coordinating activity, holding us to account, challenging us and monitoring our progress, towards offering support and mentoring and additional advice and review from expert individuals because of the serious concerns regarding a level 4 escalation status, which is for us around our finance strategy and planning. But it's important that there's important words in these roles and responsibilities, in particular about how Welsh Government work alongside us to be a critical friend, but also that feedback, that that benchmarking and enabling us to understand how there may be some shared approaches to key national issues across all Welsh NHS organisations that is helpful to share. And clearly the NHS executive is also a part of this in terms of offering additional targeted support, which is referenced earlier in terms of the touch points that we have, both with regard to finance and planning. The Health Board's been asked to appoint an SRO, a Senior Responsible Officer, to be the designated point of contact, and I'm really grateful to Nicola Johnson, our Director of Planning and Commissioning, who's is our SRO and leads that coordination on our behalf. We've also been asked to ensure board ownership and oversight with a clear governance structure, and in a slide a little bit later I'll share with you, based on learning that's been shared with us from other organisations that have faced this scenario, we've ensured that our governance arrangements, that we're utilising and using the current arrangements that we've got, and there's very clear arrangements around which committee and which reports go to where, particularly to the board. And then we'll have to produce a level 4 action plan in response to the areas of concern and ensure that we strengthen and deliver quarterly progress reports and evidence against the escalation plan to Welsh Government. On the next slide, it's important to share the formal de-escalation criteria. So we will need to deliver on all of these criteria in order to de-escalate from level 4. So first, in relation to strategy and planning, they are asking us to submit a balanced and credible 3-year medium-term plan or an acceptable annual plan in line with the current planning framework. Secondly, that the board clarity on the strategic vision for the organisation. Thirdly, that the clear roadmap and implementation of the Health Board's clinical services plan, and a little bit later you'll receive an update on our Better Together programme. Welsh Government's confidence in our assessment and maturity against the planning maturity matrix will be tracked. And then the key issue for us is that we deliver our Health Board plan, particularly in relation to the ministerial priorities and the expectations and enabling actions that were published as part of the Planning and Performance Framework earlier this year. In the finance domain, we need to be able to demonstrate that we've got appropriate and robust financial governance and a financial control environment in place to minimise risks, that we make substantial progress in delivering the level 4 action plan, including actions to improve the organisation's understanding of the existing deficit and key drivers, and also to develop further and deliver financial opportunities for improvement. And then there is an annual plan developed with full board approval, demonstrating a commitment and a substantial financial improvement trajectory. And as has been stated earlier, Welsh Government have set a target control figure for us to meet currently of 12 million, and the expectation has been set to deliver that as a minimum. On the next slide, we're just giving you 4 key areas that have been identified as the most important for us to look at initially, and I'm pleased to report that Welsh Government supporting some external procurement for us to procure additional independent review so that they can stress test our arrangements and our plan, and in particular cover these 4 areas. So firstly, they want us to look at our commissioning and contracting position, in particular around making sure that we're monitoring commissioning contracts within resources available. Secondly, one of our key drivers of the financial position is continuing healthcare, and they will be wanting us to look at how we can develop further our plans and improvement plans around this, particularly around alternative and sustainable solutions. Thirdly, in terms of external planning and transformation capacity and expertise, there's a recognition that we need to make sure that, in particular, identifying what needs to happen for sustainable services, both in the short and the longer term, and that improvement towards financial improvement, that we will, and by necessity, you need to ensure effective stakeholder, partner and public engagement. And then finally, that audit expertise is ensured and secured against the key de-escalation criteria, and then that is forming part of our audit plan during the year. So that will be the key areas of support that they're looking from us in the next year. On the next slide then, we've set out our approach, our governance approach to managing level 4 escalation. And as I said, learning from elsewhere, and some people have shared their experiences with us, we wanted to ensure that we're utilising our governance framework to embed our approach, our improvement approach, and to meet the TI de-escalation criteria. And I think particularly earlier, the question that was raised around our annual delivery plan and that alignment with the actions that we need to take around de-escalation is something that we are very aware of. So you can see from this, as the chair mentioned, there are a set of chairs' objectives which are generic for NHS chairs, but as well specific for Powys, that brings in the level 4 escalation and the need to be able to show substantial progress in year with regard to that. And that clearly also is reflected in my objectives as accountable officer. The board has to demonstrate board ownership of escalation and make sure that we're driving forward and making sufficient progress, and in particular setting the right culture, strategy and risk appetite to the approach to this. And then you can see we've mapped the other responsibilities through to our current committees so that we can ensure that we're covering this appropriately through our existing governance arrangements, because we are in routine arrangements for our governance and leadership and culture, and therefore utilising those mechanisms felt was the right approach for us going forward. And then the next slide, if that's okay, thank you. So just some key points to mention. We have to ensure that there's full board ownership, that we are delivering that level of reporting and progress that they're looking for, and in particular that we're responding to the draft de-escalation criteria through our annual plan delivery in year. In addition, it's really important that we make excellent progress on Better Together, the transformation programme, and in particular that engagement approach, so that we can set out a longer term route map towards financial sustainability. And then finally, just in terms of the expectation around how we work with partners and staff internally, clearly we have to ensure that the whole organisation is fully aware of our position and what we need to achieve. So staff involvement, frontline involvement is absolutely critical. And clearly also partnership, working with all of our partners, particularly our local authority locally, in terms of making sure that we can deliver against our plan, will be absolutely essential. That is broader partnership as well, particularly from a commissioned perspective with our neighbouring health boards and trusts in England as well. And then the next slide is around planning and strategy. And again, just a bit of a reminder, we've had a good level of internal audit assurance on our planning process and monitoring arrangements this year, but clearly, and we have self-assessed against our planning maturity matrix. And once we receive feedback on that from Welsh Government, we will be working through what additional steps we need to take to further strengthen our planning approach. And I think in terms of, in particular for us, the work that we've done around level 4 escalation, external capacity and expertise, we recognise that we do need to make sure that we have got a very strong communication and stakeholder engagement approach, supporting both Better Together and any in-year actions that we need to deliver. So again, we're moving at quite a pace to ensure that these actions are taken forward as an organisation as part of our annual plan delivery this year. Just next slide, thank you. And in terms of finance, some of these issues have been already covered in discussions earlier, but we have sent already and considered the grip and control report that went to the Audit and Risk Assurance Committee on key control actions. We've reviewed our scheme of delegation and standing financial instructions and budgetary control and savings. Just some examples there on some of the controls that we've reviewed and checked. We've also got focused escalated action groups around variable pay, continuing healthcare, prescribing and a non-pay scrutiny group. And clearly we've discussed the work that we've undertaken in year to further strengthen our controls around workforce vacancy. We also have a very clear investment and benefits group to help us to inform our assessment and scrutiny of any investments in year, and that process is undertaken prior to any decisions being formally taken by the executive committee around any investments. And then clearly in terms of that regular touch point between both the Director of Finance and myself with budget holders, and the monthly performance review process has also been strengthened alongside this. In terms of the issues around this work, clearly the external review will be checking some of the arrangements that we'll have, and they'll be stress testing from an independent perspective if there's further actions that we could undertake to further enhance our delivery confidence and to turn around the financial position that we're facing. And then one more slide, apologies, taking a bit of time, is just in terms of the dashboard against the roles and responsibilities, just wanted to give assurance to the board that in the key actions that we've been asked to undertake, we have undertaken those relevant actions, in particular around the SRO role, the ownership across the organisation, the level 4 action plan work, and then the progress reporting that we've participated in to date. But clearly the strengthening of the formal review mechanisms to support the agency in delivering confidence and improvement to the financial position, we will be revisiting that after we've completed the independent review of our arrangements, and again hopefully being able to give further assurance that there's nothing more that we can do to, or more that we can do potentially to actually further strengthen our delivery confidence there. So that was a summary, Chair, of the key position that we're facing, where we are currently in relation to the framework, and more than happy to take any comments or questions. Thanks.
Thank you, Hayley. Really helpful. And you mentioned board ownership. It's something that we as a board have had a very laser focus on. Clearly, this is coming to us in this meeting. We've mentioned the role of our committees, and of course we spent some considerable time in our board development conversations looking together at these matters. So thank you for drawing our attention to that. Colleagues, would you please indicate if you'd like to ask a question or make a comment or contribute to the conversation in response to this report. So I will go initially to Jen, please.
Diolch, Carl. Thank you. I think I do have my camera on. Yep. Okay. So thank you so much, Hayley, for this report. And as you acknowledge, Carl, we've talked a lot about this in our board development sessions, and they've been really helpful discussions. And thank you to you and the team for all the work you're doing to keep us updated. I'd just love for you to elucidate on a couple of things. First of all, timeline. I guess the timeline is such that we will take as long as we will take as long as is needed in order to get us through these escalation criteria. But I wonder whether there's any sort of timeline constraints put by Welsh Government. I note the additional capacity that this is putting on, particularly all of you, but I understand, given that Nicola is the SRO, the additional capacity and how one is able, you as an exec committee are able to sort of absorb that. And then some quite specific questions, particularly, first of all, you identified in your overview that there are some potentially some shared approaches to common issues across other health boards, given that other health boards are in a similar situation, as you outlined at the very beginning. And you reference, Hayley, that governance arrangements is an example of the work that you and your team have done in understanding how we can improve governance arrangements in terms of managing ourselves out of this criteria. Are there any other conversations happening with health boards in terms of any lessons we can learn from how they are managing the situation in relation to our escalation criteria? And also in terms of the de-escalation criteria, I note that there is a comment that the board clarity on strategic vision for the organisation. So for me, by implication, that suggestion that's telling me that statement suggests that we are not clear on our strategic vision, and I'm not sure that I would agree with that. I'm not trying to be sort of defensive of any or anything, but I wonder, is that because maybe we are not able to deliver our vision and our strategy within the resource available? So I just wonder what's behind that. I would appreciate your steer to us on that. And finally, from me, what's your advice about how we achieve that optimal balance between some competing priorities where, for example, the support that Welsh Government are going to give us, that welcome support that Welsh Government are going to give us in terms of helping us get out of this situation. And one of those criteria is about monitoring commission contracts within the resources available. How do we try and realise that with that sort of competing priority from particularly maybe ministerial priority around needing to reduce waiting times, needing to reduce the number of people on our waiting list? Sometimes that's a rock and a hard place, and it's really difficult to, I would imagine, to try and find that sweet spot. So would just appreciate your steer, Hayley, on the best way that you feel we can optimally try and manage that balance. Thank you.
Thank you, Jen. Hayley, there's a lot there, and I'm conscious as well that we need to kind of just manage our time for the rest of the meeting. So if you'd like to respond to Jen initially, we have a number of other colleagues that want to come in, but as succinctly as possible, if that is possible. Thank you, Hayley.
I'll do my best, Jen, but maybe we'll need some follow-on some of the aspects. But the first thing to say is, clearly when we originally did this plan, last year we were talking about a 5-year horizon towards financial balance in the conversations that we had, and clearly there's a current gap between what Welsh Government would like us to do in terms of delivering our target control total this year, and then moving at a faster pace towards financial balanced position. So that's one of the key issues that will need to be tested as part of the independent review coming in to support us, because we feel we've made that assessment, but actually there's a gap. at the moment between what we need to deliver and the current position. So the timeline around how quickly we can move towards a balanced financial position is one of the key stress tests that we need to discuss with Welsh Government. The issue around capacity is we have to absorb this. Colleagues, it is not a choice. It is a escalation based on our regulators' discussions, and we have to respond appropriately to that. And that is about the approach that we've taken in rejigging and considering content around our delivery plan as a result of being an escalation. But I think particularly the independent review is a constructive and trying to be a helpful tool to support us to identify additional actions and to give assurance to both Welsh Government and to ourselves that we're doing everything within our power to be able to resolve this matter as promptly as we can. In terms of the learning from elsewhere, we're starting on that journey. I certainly would say that the conversations that I've had with colleagues at chief executive level, but I also know that, for example, Pete through the Directors of Finance and Nicola through the Directors of Planning arrangements also share learning in that space. But I would say around some of the key cost drivers that is driving the financial pressure across NHS Wales, the key area in which we're drawing some of that together is under the Value and Sustainability Programme Board that is led by Welsh Government, and you'll see some of the key targeted work around that is around prescribing, continuing healthcare. The list is very similar to the cost drivers that we've got. So those are some of the mechanisms. I think I haven't taken that our strategic vision is not clear, because we were one of the first health boards to work with our partners, particularly social care and the third sector, to deliver a 10-year vision in Powys. But that naturally 10-year period is coming to an end in 2027. So I think it's about recognising we will need to look again at that longer term strategy going forward. So it is needing to be updated, and we've got a plan to do that. And then that issue around, I haven't got an easy answer to this one, Jen, about the optimum balance between competing priorities, delivery against ministerial priorities, money, quality, performance. One of the key things we're trying to do here is not to further escalate in other domains. The other domains that I mentioned, performance and outcomes, governance and leadership, culture, etc. And that's the fine balancing act at the moment, and that's a whole board conversation. But I think that, to put it into context, other health boards are also an escalation, a level 4 or level 3 for other domains, particularly performance and outcomes, and some for leadership and governance as well. And, I'm really keen to try our best to maintain a routine monitoring status with regard to the other categories that they praise. I hope that's okay, Jen, but happy to have further conversations.
Yeah, incredibly helpful. Thank you very much indeed for that reassurance.
Thank you, Jen. So let's take Steve and then Chris, and then perhaps a final word from you, Hayley. Thank you.
Thank you.
Thank you, Hayley. That was a really systematic overview of the process. And you touched on finance and some of the financial controls, which we've obviously taken a paper through ARAC on, which have been really helpful. Most of those controls are really focused on trying to control costs. You mentioned the investment and benefits group, and I just wondered, is there any work being undertaken, or is there a process to consider potential areas? I know this is extremely difficult, and obviously we've had further discussions earlier today about quality, but look at areas for potential disinvestment where services are being provided that might not generate the levels of outcome that would be appropriate. So it's a sort of disinvestment group as opposed to an investment group. Thank you.
Thank you. Chris, would you like to come in with your comment as well, please?
Thank you, Chair, and thank you, Hayley. Likewise, as been said, a helpful report. I particularly welcome the focus towards partnerships, and particularly with the local authority. but I would say that being the independent member for the local authority as well. But one of the areas that you flagged up is about continuing healthcare, and I want to be assured around the conversations that are happening then with the local authority in relation to that, to see how we can try and address that and more ownership. You mentioned about the independent review of the plan, and I just wondered whether then there's going to be any crossover with the arrangements with the local authority to see if there's any shared learning. I believe that the local authority have recently had some a similar type of exercise done, and there may be some shared learning there, so it could be a two-way process that help both organisations out. Because the financial challenge within the local authority is just as apparent as it is within the health board. So let's not reinvent the wheel, let's learn from it to see whether they're moving forward. I was also interested that you focused about audit expertise, or are you saying it's audit capacity around what we need? Because the internal audit process, I find within the health board, has been fairly robust, and I do sit on the audit and risk group committee, so I know that it's that's okay. And then what are the implications to the Powys population? And I think it's where do the conversations then start about, one, what do they need to do in order to help move some of this agenda forward? I'll stop there. Thank you.
Hayley, final word to you.
Thank you. Lots in there. Just Steve, just on the disinvestment, the first thing to say is the investment benefits group are reviewing the investments we've made and have they realised the benefits that we were anticipating, and therefore, if unfortunately we're in the environment, if it doesn't, then we will have to revisit those issues. So that's the first thing. In terms of the conversations around disinvestment, we have had very early conversations around this, and what I mean by that, I'm sure you've picked up some coverage from the NHS in England around some of the conversations that are currently taking place around non-essential services as well. And I think we have just started early conversations as an executive team, and we will need to have a whole board conversation around that. But I'm also very aware that some of those conversations probably need a more national conversation about them. Particularly, we had a very strong framework during the pandemic around the prioritisation of essential and non-essential in extremis. And clearly, you know, there is more work to be done around that disinvestment conversation, Stephen. So I'd say we're early stages on that, and we need to do further work and bring further assurance to the board on those conversations. I think, Chris, your point around local authority partnership is absolutely critical, because if either party isn't able to deliver what's required, it has a catastrophic impact on each other. You know, it's a mutual relationship, and I think in the JLT joint leadership team space, the local authority in particular have been very open with us around the investment of work that's been undertaken to review their plan with Newton Europe, and that's been very helpful. We've taken learning from that, and we're at that stage now of procurement of our external review. So they're separate because we have separate accountabilities, but absolutely in that middle of how do we take the shared learning, that will be key for both organisations. And there's a question around implementation as well. How do we take the solutions or actions forward? And I know that in joint leadership team, and I've had separate conversations with Emma Palmer as Chief Exec of the local authority around, gosh, how we how do we move towards implementation on some of these shared actions as well. On the audit expertise, we were aware of the draft escalation criteria when we set the internal audit plan as an organisation this year. We hadn't confirmed it, we hadn't had the final draft, but we were aware of the areas that Welsh Government was seeking further assurance on. And I believe that our current internal audit plan does cover the matters within within the requirements and targeted intervention, but that's subject to a conversation with our committee members and with Welsh Government to see whether they feel that's adequate or whether there's a little bit more targeted audit activity that they would want us to be considering as part of the intervention. But I think we've already taken that step forward, Chris, and I agree with you. I think we also have invested over and above in our internal audit plan as well. So that's one, I think, that requires further dialogue with Welsh Government so that they have an opportunity to review our internal audit plan to check that that meets their requirements. And the final question, which is really hard to answer at this stage, Chris, I think for me, the Powys population is back to that engagement piece, and how do we involve the Powys population in both the scale of the challenge we're facing and also the choices we will have to make for the future. And you know, there's no easy answer here, but clearly in everything we do, we try and avoid anything that has a direct patient impact. So we'll always go for the areas first that doesn't have that. But the reality with the scale of the deficit we're facing, we're going to have quite difficult conversations with the public around those options going forward. You know, that's the commitment we've made both in the Better Together programme and in the culture and the expectations the board has set in how we move forward with this work.
Thank you. Thank you all. In relation to this very important report, we are asked to receive it, to note the escalation framework that's in place, and we have sight of that in Appendix 1 in our papers, to take assurance that appropriate mechanisms are in place to monitor and report to us as a board and our committees, to approve the governance arrangements in place to support escalation status, and that's set out on slide 8 of Hayley's presentation, and we have a copy of those slides in our paper pack. And finally, to note the procurement specification for external support will be approved by the Chair and the Chief Executive. Once again, please indicate if you don't support the recommendation. That too is supported. Thank you. We now invite Nicola to speak to item 4.3 on our agenda, which is the month 12 integrated quality and performance report from the 24-25 year. Thank you, Nick.
Thank you, Chair. And as Hayley iterated earlier, this with the finance report and the Q4 delivery plan report that is next, this is our suite of reports that allow the board to monitor, scrutinise and assure the performance and delivery of the organisation. And these are all end-of-year reports, as you've just described. So in terms of our end-of-year performance, on a provider side, we have generally good performance, and as I've said several times through the meeting, we're planning to maintain that into 25-26. So meeting the 104-week wait target, the 52-week wait target, the therapies 14 weeks, all measures for children and young people's mental health, and the urgent emergency care measures as relating to our minor injuries units. The minor injuries units performance remains under review as part of the temporary service changes, and that report will be received by the board in July. Our diagnostics compliance with the 8-week wait, there continue to be a small number of patients breaching against that target, and performance has plateaued since last month. There is an improvement plan in place, and we will be reporting against that trajectory going forward, so that the board can be assured on that improvement. With regard to adult mental health measures, there has been volatility throughout the year due to the small teams, but general improvement across all four. And at the moment, it's the care and treatment plan and the psychological therapies part of those measures that we are not yet meeting. And the mitigating actions and improvement plans are laid out in the report as we move into 25-26. We note that we've tested our escalation process in mental health through the year, with significant improvements in those services which underpin the delivery of those measures. We also note that the Children and Young Persons Neurodevelopmental Service remains in escalation, with further to go to achieve sustainability, but there has been a significant improvement over the 6 months of that service being in escalation, with the eradication of the internal waiting list, and there now being no over 104-week waiters, which is a great improvement for our children and families in that service. But again, we discussed further work to do earlier in the meeting. In commission services in NHS Wales, there's an end of March improvement for our patients waiting for secondary and tertiary care in NHS Wales providers, with Hywel Dda and Swansea Bay now compliant with 104 and 52-week targets, and waiting times falling in the other health boards. We know this remains a Cabinet Secretary priority as we launched and revised on the 7th of April, and we expect to see further improvement for our patients waiting in NHS Wales providers in line with that. The differential in elective waiting times for NHS Wales and NHSE providers is outlined in the report as reported to the board all year, and we did have 33 long waiters in Robert Jones and Agnes Hunt Hospital over 104 weeks at the end of the year. Apologies, 39 long waiters. We remain in close conversation with all our NHS England providers following the decision that the board made in the context of the improvement options on the annual plan in March, and with Robert Jones also obviously within the context of commissioning to NHS Wales waiting times in England, seeking those assurances from Robert Jones and Agnes Hunt that they will meet that standard in year. Chair, that is the summary of the IQPR at the end of the year. I do just want to say I've presented it quite succinctly, but it does represent an enormous amount of work from all of our teams, and just want to say a huge thank you to them for delivering this level of quality and performance for our population throughout the whole of the year. Thank you, Chair.
Thank you, Nick. And on behalf of the board, I know that thanks and appreciation is reciprocated. But I will open this up for discussion and comment. Would anyone like to come in, please? Robert.
Thank you, Chair, and thank you, Nick, for the report. I just wanted to focus a little bit on some of the InReach stuff, and in particular, coloscopy. We've got InReach consultant unavailable during Q1, Q3 and Q4, and we've agreed a joint appointment for Band 7 screening practitioner. When that practitioner comes, will it really have that much of an impact? Because we're way below the target currently, and we've been concerned for quite a while now about the failures in the InReach system. Thank you.
Thank you, Robert. I will bring Elaine in to answer that question, if that's okay. Thank you.
Thank you for the question, Robert. I think it's there is a challenge for us with all our InReach services in that we are reliant on partner working relationships and the service level agreements that we have in place. We are working through that. And we are working with other organisations to try and stabilise some of that InReach provision. In terms of, was it colorectal or colposcopy that you were talking about?
I think it's coloscopy, I think.
Colposcopy.
Yeah. Colonoscopy, yeah.
Colonoscopy.
Colonoscopy, yeah.
I wish they call these things very different things, isn't it? That makes it challenging at times. So we are in the midst of those conversations. I haven't got a finalised position to share with you today. What I wanted to stress, though, I suppose, is that those fragilities we're very aware of. They're very visible, and we do have really positive working relationships internally around the elements of those services we deliver. So will that additional member of staff make a difference? Yes, I believe it will. However, we do need to stabilise the InReach element, and we will have to monitor that closely and report that closely. So if, for example, we don't see that improvement, then we will have to highlight that quickly and make rapid corrective action. But we will report that up through this report throughout the year.
You content, Robert?
Yes, thank you.
Thank you. Kirsty, please.
Yeah, just to follow up on Robert's point, the challenges about InReach service are, it seems, never ending. So I think every time we raise this issue, we get, understandably, the same answer, in the fact that InReach clinicians are not necessarily fulfilling or are able to undertake the work that we have commissioned. I guess the question for me is, rather than keep having that same conversation, what is this telling us? Because this is not new, certainly has been a feature since I joined the board. So I guess the question is, it's like, what do we do differently around this area to get a different result? Because it just seems what we've not been able to sort it until this, at this point. And then on mental health, obviously it's wonderful to see the performance in children's mental health services. So that's, we've not always been at that level, so that's really very, very positive. But adult services continues to be more mixed, and I'm just wondering, what level of confidence are we carrying into the new financial and performance year, that actually we will be able to gain some more stability in that service and work towards better compliance with targets. Thank you.
Nick, I can see that Kate and Elaine want to come in. Shall we ask them to comment first, or would you like to?
I think probably best if Kate and Elaine comment first, and if there is anything to add, I'll do it afterwards. Thank you, Chair. Please do, Kate.
Yeah, thank you. So just on the InReach question, then this is a key area that obviously it needs sort of clinical engagement and input, and has it. I think for the colonoscopy, there were two elements. There's the general service, then there's also the screening service in conjunction with Public Health Wales. And so we're working very closely with both of those organisations. And I think the practitioner, if I'm right, is related to the screening. And so I think there are opportunities there to definitely improve the service. There is a lot of conversation going on in terms of more joined up working, regional working, which is a rapidly growing conversation and is welcome. Key appointment for us has been our Assistant Medical Director in Planned Care. So Steve Edwards is currently helping us in that role and is being really effective in looking across the pathways, clinically, looking at the quality of the pathways, and importantly, as we discussed earlier, looking at outcomes. And that is going to more strongly inform where we need to intervene. And whilst so that is a very active work. We do recognise that most of the health boards have got capacity constraints at the moment, but one of the things that Steve has been looking at is how we can really effectively try and affect some change here.
Thanks, Kate. So just before we go on to mental health, Kirsty, is there anything you want to say in response to Kate?
Yeah, I guess from this kind of like, a patient experience thing here, is this the correct model? Are we for want of a better phrase, is this a losing battle that we're never going to win? We've talked, haven't we, in the organisation about a lack of capacity. There's so much being placed on executives. I do wonder, at what stage we say this is not the model we need a different model, or actually the new assistant medical director will be able to make some progress. I'm just a bit, I just wonder when we'll see a positive impact, or whether we just say there is a different way we have to do this because it's not delivering. I'm assuming we don't pay for services we don't receive, so but it's still really disappointing, isn't it, if we're pledged to deliver this kind of service for our patient and we're just simply not able to achieve it.
Okay, I know that Nick wants to comment as well. Should we go to Nick, or do you want to come in, Kate?
I just briefly, then absolutely, Kirsty. Then it's challenging. We would all like to see change faster. What we are actively doing with Nick and the commissioning team is looking at the pathways. So I think there are some things that we are within our gift to change, and the whole system is impacted. So there's some things that we can't, and so our real goal is to find the areas that we can affect change, and then we'll get there more quickly. So that is active work, and it's, to be honest, the world is rapidly changing around us, so we're constantly regrouping, but just to assure you that that is happening. And so we're having another focus on this, just to see if we could identify the areas that we can affect. And we've got really great business intelligence tools that are giving us live information about where we are. So we're improving all the time in our ability and the information that we've got on which to act. So it's not as fast as any of us would want, but I think we're doing what we can to affect the bits that we can affect.
Nick.
Yeah, thank you. So in the delivery plan that we've discussed earlier, under the Plan Care and Diagnostics Transformation Board, in the second half of the year, we will be undertaking a strategic assessment across our planned care and diagnostics service provision, looking at areas that we depend on out in reach, which, as we know, is the majority of them, and assessing where our priorities for looking at different models, Kirsty and other board members. That may include strategic partnerships with other providers. It may include insourcing or outsourcing. So because we have that commissioning approach and that commissioning expertise, nothing's off the table. And we have found insourcing really valuable in children and young people's services for neurodevelopmental services, and obviously underpins at the moment all of our planned care and diagnostic delivery in those areas that we find it more difficult to secure consistent support. So just to say that sort of systematic review is planned for the second half of the year.
Thank you. Elaine, would you want to comment on mental health?
Yeah, so just touching on mental health and that question about confidence, Kirsty. So you're right, our children and young people services have achieved quite consistently high level of performance delivery. We've seen towards the latter end of this year, our adult mental health service delivery, particularly around Part 1, step up, which is really fantastic, and making sure that we've got mechanisms in place to sustain that. The areas that we are lower on then is Part 2, our care and treatment planning, and also our psychological therapies. So there are active plans in place that we are monitoring and tracking to see those step up above the target level within the early part of this year, 25-26. The challenge for us is then going to be sustaining and maintaining that. So again, I'm confident, I'm increasingly confident with the plans that I've seen that are in place there. It'll be up for us to monitor and ensure that those deliver what we need for our population.
Thank you. You content, Kirsty? Thank you. Thank you all. So we are asked in terms of item 4.3 on our agenda to discuss the content of the report that we have done and to take assurance that the Health Board has appropriate systems in place to monitor performance and to respond to relevant issues. So I'll assume the recommendation is supported, unless anyone wants to indicate otherwise or step in with a comment? No, so that is supported, and we're staying with Nicola for item 4.4, the annual delivery plan report, and again, an end-of-year report for Q4. Thank you, Nick.
Diolch, Cadeirydd, and I'll present this quite quickly on the basis that it has been read, and we have discussed elements of this already in the meeting in the context of other reports that we've received today. So again, this is the final part of our suite of assurance reports on delivery of the 24-25 plan, which outlines of the over 200 deliverables in that plan, our progress and assurance on delivery. As can be seen, and so this is the end of year report, and it will feed into the annual report, as will the products of the integrated quality and performance report. As can be seen, the majority of the deliverables were delivered, with about a quarter being off track or behind schedule, and as we've already discussed, those have been reviewed for inclusion or not in the and rolled forward in the annual plan, where it was agreed that they wouldn't. It was because circumstances had changed or they'd been accelerated or wrapped into other deliverables. As we've also referred, we use our progress on delivery of every year's plan in informing our planning for the future year, and we did that in the annual plan for 25-26. Because this is the end of year report and we'll be using part of it for the annual report, our achievements in year, both in process terms but also in terms of the detail of changes in our clinical services, are outlined in the report as a summary for the board. And also those that were behind schedule or not delivered, again, for assurance purposes, for completeness, are outlined in the paper. In discussing this with the Delivery and Performance Committee, there was a specific point raised around the engagement with patients and stakeholders on the perception and experience of access in primary care, and this was picked up, and therefore that has been reviewed, and an additional deliverable will be incorporated and has been incorporated into the 25-26 delivery plan as a result of that going forward. To make sure that that important point about patient experience in primary care remains with us. So this is for noting as part of the assurance mechanisms of the board on delivery of our annual plan 24-25. Thank you, Chair.
Thanks, Nick. As you say, aspects of this report have been part of our conversations so far in this meeting. Also worth noting that it has had detailed scrutiny in our Delivery and Performance Committee, and they haven't raised any issues for our attention and certainly haven't escalated any matters. So I will pause to give people an opportunity to come in with any question or comment. Please do so if you'd like to. No, so the recommendation is that we consider the report ahead of submission to Welsh Government, and that we take assurance that there is a process in place for monitoring progress against the plan. Once again, I'll wait to see if anyone wants to comment on that recommendation or dissent from it. No, therefore that is supported. Thank you very much. Mention has been made on a few occasions in our discussions today about the importance of our Better Together transformation programme, sometimes referred to as our route mapped sustainability. It's our longer term plan to get us to where we need to be in terms of our delivery and our service model, our financial position, and so on. And so I'll invite Deb to speak to this item. Thank you, Deb.
Thank you, Chair. So this is an assurance report setting out the latest position with the Better Together portfolio. The case for change is now at stage 1, and public engagement commenced at the end of April and will run until the 25th of May. You'll recall within the annual plan, we decided to accelerate community and adult mental health services, and clinical and operational work streams are in place to support. There is comprehensive engagement activity in place internally and externally, and a range of workshops and meetings are either in place or in the process of being organised. Within that, then there will be the consideration of the data, what the data is telling us about future service design. We'll also be supported during the engagement and consultation stages with an external procurement, so that those additional resources offer some impartiality and support our teams with the activity. The next steps are set out in the paper to include check and challenge sessions, moving into stage 2 of the public engagement, which will commence on the 9th of June. As a reminder, the public consultation on the options being put forward will commence in October through to January. So in summary, the portfolio and the work plan is not without risks and challenges, particularly on the competing priorities, which we've mentioned in other places today. And particularly kind of given the accelerated timelines. However, we are making good progress, and we are in line with the accelerated timetable that we set out previously. So I'm happy to take any questions. I should know, apologies from Lucy Cornish, who would normally support this item. She's otherwise disposed today.
Oh, thank you, Deb, and fully understand that. And of course, as I mentioned earlier, this has been the subject of rather detailed conversation among the board. We're in a number of board development conversations and days and sessions and so on. So it has received a lot of attention and will continue to do so. And of course, our PPPH committee will also have a particular role in its oversight and scrutiny. And Robert, if you have any comments that you'd like to make, then please come in. But colleagues, would anyone like to comment or ask a question or join the conversation in relation to the Better Together report? No, so there are no additional questions. So thank you for that, Deb, and it's really assuring to know that, as you absolutely say, you know, capacity is at a premium, and but the fact that we are on track for this very key and very crucial area of our operation is very assuring and very affirming. So please do pass on our thanks and appreciation to all the team for the work.
Thank you.
So the recommendation is that we note and take assurance on the progress made in relation to the delivery of Better Together. We endorse the strategic direction and proposed timetable, recognising alignment with the Health Board strategy, national policy and legal duties, including the duty of quality. We also note the planned forward activity, and we note the risks identified and mitigating actions in place. Please indicate if you'd like to comment on or dissent from the recommendation. That too is supported, and certainly as board members, we look forward to our conversations and our engagement with the people of Powys as we shape this together so that we can put in place the best possible, most timely healthcare for our population here. We turn now to item 4.6. As has been indicated already in the meeting, at our July meeting, we will receive the full evaluation report following the 6-month temporary implementation of the service changes we approved some months ago. So this is a report to us at this stage, and I'll ask Kate to speak to it. Thank you, Kate.
Thank you, Carl. So I'm going to take the paper as read. So as you said, we provided an update in March. This is the next planned update ahead of full evaluation, which is planned to take place in June, with a report coming to the board in July. So just really to provide assurance that evaluation and monitoring is ongoing and that the mitigations are in place, and that since the last presentation in March, there is nothing else to formally escalate.
Okay, thank you. Ian, please come in.
Thank you, Chair. Thanks for the report. I was fortunate to get to see the MIU at Penllandrydnod with Ronnie a little while back. I was quite impressed with what was going on there. So that was all very good. In terms of the consultation left to be done, I note, I think it's on page 3 of the paper. There are 3 categories: primary care, third sector, PTHB staff, and then service user and patient stories. Can I just check? Have the consultations been conducted already, or have we that left to do before we get to the final stage report, please?
So thanks for that, Ian. So we had a planned contact at 3 months, and that has been done. And a brief report of that has come to the Strategic Change Programme Board. That will be repeated just before, in fact, it's due to be repeated quite shortly, just before the 6-month check-in. So there's a 3-month and a 6-month. So 3 months is complete, and the 6th month is about to take place.
Okay, thanks very much.
Thank you. So the recommendation is that we receive the update on progress to date, including the evaluation and monitoring plan, and we take assurance in relation to the delivery of the mitigation action, the mitigation plan. Do indicate if you don't support the recommendation. Thank you. That's supported. So we turn to item 4.7, and we're back with Deb and the Speaking Up Safely and Raising Concerns report. Thank you, Deb.
Thank you. And just to note that the contents of this paper have previously been discussed at Local Partnership Forum. So the paper sets out all of the Health Board's activities since the Speaking Up framework was published in September 2023, where there are a range of actions were required as part of that framework. Within the report, you can see that many of these have now been closed. And whilst speaking up safely is of course important, and it is essential that everyone knows the routes and channels to raise such concerns, for many of the remaining actions, it is proposed that we now mainstream these into our business as usual processes. To date, and since 2023, there have been 12 Speaking Up Safely submissions. Having assessed these, all of them were low level and didn't require any further intervention. Just to say that in terms of those actions that we're saying we'd move into business as usual, it doesn't mean to say that we are diminishing the importance or will stop monitoring and reviewing the data and triangulating that data with staff survey, team climate reports, employee relations issues, and all of that will continue to be overseen by the Speaking Up Safely group. Carl and myself have a role to play in this, in that we are the non-exec director and director leads, and we will continue to discuss those. And as importantly, I will continue to report through to People and Culture Committee. Happy to take any questions. Thank you.
Thank you, Deb. Claire Roche, please come in.
Thank you, Deb. Thank you, Chair. I think it's really important that as a clinical director, I acknowledge the importance of this framework. It is a very, very clear component of being able to ensure that we're an organisation that has psychological safety for our staff, whether that is in the clinical environment or indeed in the non-clinical environment. And actually going back to the conversation we had when we were presenting the integrated quality and performance framework and thinking about the principles in that framework of transparency and accountability, this is a really good example of a piece of work that, you know, is not in isolation. This is clearly a vehicle that enables us to deploy our integrated quality and performance framework. And certainly from a clinical perspective, it is incredibly important that clinicians and practitioners are enabled to be able to speak up safely and ensure that patient safety is paramount. Thank you, Carl. Thank you, Deb.
Not at all. Thank you. Pete, are you wanting to contribute? Sorry, I just saw you on screen, so I just wondered whether you were in fact wanting to contribute. I'll just pause. As you say, Deb, this very important work will continue. It will receive scrutiny and by our People and Culture Committee on an ongoing basis, but I can't see anyone else wanting to come in with a comment or a question. So we'll go to the recommendation, and we are asked to take assurance that PTHB has met its obligations in meeting the specific requirements set out in Section 6 of the National Speaking Up Safely Framework and Welsh Health Circular 2023/036. Again, please indicate if you want to comment on the recommendation or if you don't support the recommendation. That, too, is supported unanimously. Thank you so much indeed. And certainly not least, but the last substantive item on our agenda is the report from Katie Blackburn, the Regional Director of Llais in Powys. Good to see you, Katie, and over to you.
Thank you, Chair. I'll be very quick and I'll work on the basis that people have read the report. I'm happy to, happy for people to email me if there's anything you want to pick up outside of the meeting. I just think, firstly, just to draw board members' attention, about 10 days ago, we published a pretty horrifying report on maternity services, which I've included in your papers. And I think from a Llais perspective, must be said that it's so disappointing that the same issues came up in SAF and were raised in SAF and Cwmtaf Morgannwg. So we will be, I've had initial conversations just to check whether any Powys patients access those services. So we will be working with colleagues just to understand whether there are Powys patients impacted by those services in Swansea. Last week we undertook a public forum in Llanfyllin, which was really interesting. And we've got one coming up in Ystrad in June, and then a Llais local in Crickhowell. So if anybody would like to join us for any of those, or join us for a coffee morning or whatever, do let me know. And or if you perhaps, let me know, or let Helen know, and I'll make sure we've got an invitation to you. And then I think really finally, Chair, just following on from what Kate was saying about the temporary service changes, I think I've fed back before that we have visited both the co-located sites for Ready to Go Home and for rehab and stroke, and had really, really positive feedback. Those reports are being prepared as we speak. I suppose there's just one word of caution. I suppose we're picking up just a small amount of noise about potential unintended consequences of those co-locations. And so I would hope to see in that evaluation report in July reference to whether there are unintended consequences from those decisions. But that's it from me, Chair. I'm happy to take any questions.
Thank you, Katie. Really good report as always, and very, very enlightening and useful. And And thank you for the invitation to the events as well. And certainly something I've made a note of, and something we'll come back to you about. I think that's a very helpful invitation. Claire Roche, you might have a comment on maternity. Kate, I wondered if you might want to come in terms of the evaluation and the inclusion of unintended consequences, and indeed, colleagues, if there are any other responses to Katie's report, then please do come in. Claire.
Yeah, thank you, Carl, and Katie, thank you for the report. I just want to provide assurance, really, to FLICE and indeed to the wider board, that we have obviously acknowledged that report in relation to Swansea. We had already, prior to the publication of the report, done an assessment of how many women potentially access those services, and we had some proactive conversations with those women. However, on the publication of the report, that has continued, so our local midwifery teams are doing that. But just to provide some assurance, we do now actively reach out to all women, regardless of where they have had their maternity care, but particularly from any maternity care that is commissioned, we do actively reach out to them following their birth to be able to have any feedback, anything that will inform our commissioning arrangements. So I just want to give the assurance to everybody that that is in place. Thank you very much.
Thanks, Claire. Kate?
Yeah, thank you. And Katie, absolutely. So as part of the evaluation, everything will be brought forward and considered in the round. We have disciplined ourselves with the numbers are small, and so we've disciplined ourselves not to evaluate as we go along because there's risk of bias there. So we will be looking at absolutely everything, and there are mechanisms set up to consider everything. And without prejudging, what I am sure is there's going to be really useful learning for us from this in terms of the way our system's operating. But yeah, absolute assurance that they will be considered.
Thank you. Jen, please.
Yeah, thank you. Katie, thanks for the report. I just want to sort of double check with you really about in those areas. Really great to see the positive comments that people are saying about some of the service, and that's also good to see, isn't it? So thank you very much for sharing those with us. In terms of those where our public are saying that there needs to be further improvement, are you aware that where our public feel that there are shortcomings, that they are using either the complaints process or they're able to feed their concerns and challenges directly back into whoever the provider is? Because in order to receive that, in order to improve those services, it's we need to know, and then we can monitor them, we can capture them, and then we can feed them in. So, do you feel that our colleagues are doing that? Our population are doing that sufficiently?
You're on mute, Katie.
Sorry, thanks.
I'm just glad that somebody else has done that in this meeting. So
we started and we finished. Yeah, I am confident, Jen, and that's partly our role as FLICE as well, to act as that conduit. So not everything is a complaint. It might be that people just don't know how to, or haven't, don't know where to access some piece of information, or they don't understand because it's not clear what the criteria is for something. And so what we would do then is we pick that up with the health board or with the local authority and discuss that to make that improvement. So it's not always a complaint. It might be something like as I've described. But yeah, I'm happy that we promote our service, the options available within the health board. And I think once we've also done a FLICE local, we sit down with colleagues in the health board and the local authority and the third sector to pull together an action plan about what's come out of that sort of particular focus discussion. So yes, I am happy that those opportunities keep being promoted.
Thank you. So thank you very much, as always, Katie, for the report and the responses and so on, and for the invitation. Much appreciated. That brings us to item 5 on our agenda, the consent agenda. And so, as I explained earlier, the items under section 5 of our agenda are supported en bloc, and therefore they don't need any further discussion. I'm not aware of any other business, and so I assume there is none. The date of our next meeting is the 25th of June, and therefore that concludes the business for today. And it simply remains for me to say a big thank you to all who have made today possible, both in preparing for the meeting, in contributing to the meeting, in feeding and participating in all of the discussions and the decision making. A huge amount of work, absolutely noted and much appreciated. Thank you.